Welcome to Deuk Spine Institute. Our patient has horrible neck pain. He's had fusion done elsewhere, not here at Deuk Spine. The fusion was done for spinal cord compression, myelopathy. He was going paralyzed. The surgeon went in, you can see on the x-ray, and did basically a double fusion. Fused 2 discs below, 1 disc above. He had a clipple file, which is an auto-fused C4-5. So he did a 3-4 and a 5-6-6-7. Now the patient comes with horrific pain above his fusion. Take a look at that x-ray. Show them, Jordan, the arthritis happening above the fusion. Go ahead and point the x-ray. You can see all that bone spur there. That's why he's in so much pain, folks. So he was here to get his back fixed, and he said to me when I was seeing him, well, my neck is killing me. Can you fix that? And I said, absolutely. Don't move his head unless you absolutely need to. All right, so Henry, let's show the audience, why do people get facet pain? What's the basis? It's about done.
Facet joint injury is a common cause of chronic neck pain. The inflamed facet capsule tear generates pain signals. The best treatment for facet joint pain is the Deuk plasma rhizotomy. The inflamed facet joint pain nerves are destroyed. The advantages with the Deuk plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
Sean, welcome back. We're just putting our final touches on this procedure. And once again, our patient has horrific pain in his neck. It's debilitating. He can't move his head because his facet joints are so arthritic that they're causing massive pain. Now, most doctors could never figure out what's wrong, let alone fix it. But at Deuk Spine Institute, we're done with the right. We have determined the source of his pain to be his facets above his fusion. They're full of arthritis at C2-3 and possibly C3-4. So we're treating the C2-3, C3-4 facets on both sides with our Deuk plasma rhizotomy, a patented FDA-approved surgery. Patient is asleep. He's comfortably resting. Any questions from the audience?
Yes, we have a question coming from Charlie on YouTube.
Hi, Charlie. Welcome. You can see that massive arthritis at the tip of my probe there.
Charlie on YouTube asking, you mentioned proprioception during the previous video. How is proprioception affected, and what are the symptoms/signs of that?
Yeah, so what I was talking about in the last video was how all of the sensory inputs in your body travel via nerves, and they travel from peripheral organs, sensory organs, okay, peripheral, meaning out in your body, like your fingers, your joints. They travel from those remote locations back to your brain. And They travel there along nerves and then the spinal cord, and then they make their way through the brainstem up to the parts of the brain where the interpretation of signals occur, okay? And the interpretation, conscious interpretation of signals, sensory signals, the conscious interpretation of where you're aware occurs in a part of your brain called the cerebral cortex, which is the outer surface of neurons covering your brain, and specifically in an area that's called, I believe it's Brodmann Area 312, which is literally 3 numbers, which is known as the primary somatosensory cortex, okay? So all of your sensory inputs that are somatotopically organized, meaning related to a specific region of your body, and your brain knows exactly where that part is, where it came from, the signal came from. Those inputs include proprioceptive, discriminative fine touch, basically, and pain and temperature. And they literally travel to this part. I'm pretty much done here. They literally travel to this part of your brain where your brain can interpret the signals and know exactly where on your body those signals came from. And that's what I'm saying, okay? So I'm not really talking about proprioception, which is sense of where your joint is or where your finger is or toe is in space. That proprioceptive input I'm not really talking about, except that it also goes to the primary somatosensory cortex. So I'll show you guys in a second here. We'll pull the fluoro out. All right. Look at my thumb. You guys see this thumb?
Yes, we
Now,
do.
If I have Luis take my thumb, go ahead and take my thumb, hold it like this. No, like this. And you can either move it down or up, okay? I'm going to close my eyes, but I'll tell you exactly if my thumb is down, up, down, up, down. I can tell the position of a joint with my eyes closed because I can sense the position of the joint. That's called proprioceptive sense, okay? Sensing the position of a joint in space. And that ability requires 2 sensors near your joint called the muscle spindle and the Golgi tendon organ, GTO. And those sensory organs located in the tendons around your thumb, and the muscle spindles that are also near the muscles for the thumb position, they send inputs up to your brain about being stretched, basically. And they tell your brain what position your thumb is in. Even though your eyes are closed, you can't see it. That's called proprioceptive inputs. All right, thanks for joining us. We're done. We've just completed a cervical Deuk plasma rhizotomy for facet pain. You're watching a state-of-the-art surgery that this is the first it's been done in the world at Deuk Spine Institute. We're the pioneers. It's a permanent rhizotomy to kill neck pain permanently, so it never comes back. If you know somebody with neck pain, have them do our free MRI review. There's no charge. You get to meet me in person. You get 10 minutes with me, and in 10 minutes I'll tell you exactly what's wrong causing your symptoms. And we can fix it. That's the best part of it. So you don't have to live in pain anymore. Come to Deuk Spine to get fixed.